It's the AEMT lecture series. Welcome back. This will be video number 1 for chapter 23, Toxicology. So glad to have everybody tuned in with us. This chapter is really not difficult. There's nothing new added to the AEMT scope, unless you consider Narcan IV for some of this. But other than that, I mean, this information is not new. Let's talk about the objectives real quick, because really, everybody wants a study guide or whatever, but really the best study guide you can have is the objectives. Understanding the objectives for the chapter, and then you'll be fine. You should pass every exam. And so this is the National EMS Education Standard Competencies, and you'll see that they want you to understand how to provide basic and advanced care for and complete assessments findings for an acutely ill patient that would be a toxicology patient, recognizing and management of. And then they have carbon monoxide poisoning, nerve agent poisoning, which really we're not going to talk a lot about nerve agent poisoning. We're just not. There's not that much information about it, and there's zero on my exam on it. How and when to contact Poison Control Center. So one of the slides has a national telephone number for poison control, but we have a local one, and we use Grady Poison Control. And if you've never used them, I would recommend that you start using them. They're usually staffed by physicians and toxicologists, and they really know their stuff. A lot of times you don't even have to transport the patient. They'll recommend non-transport, which is cool. So anatomy and physiology, assessment, management of. So understanding the anatomy, the physiology, the assessments, assessing the patient, and the management, the treatment of inhaled poisonings, injected, all the way down the list. And so we'll talk about each of these. Okay, so when it comes to we see these calls quite often, right? We go to the possible overdoses, and we know that sometimes they're on purpose, sometimes they are not, sometimes they are accidental. Sometimes when they're accidental, whether they be accidental or whether they be on purpose, there's two different types of poisons, right? We have the ones with drugs that are illegal, illicit drugs. And then we have those drugs that, the accidental sometimes happen on, which are lytic drugs. They're legal. So what is a poison? It's toxic by nature. Okay, it's no matter how it gets into the body or in what quantities. At minimum, it makes a person ill. Okay, at worst, it will kill a person. A drug, right, is a substance that has some therapeutic effects when used properly. As long as it's in the appropriate circumstance with the appropriate drug dosage, then that's a good thing. When you use the opposite of that, it can be a bad thing. Toxicology. sorry guys, I had to pause y'all there for a second. So what is toxicology? The study, all right, of toxic or poisonous substances. All right, so we can find these things everywhere. Toxins can be found everywhere and anywhere. So so here's that number for the Poison Control Center. It's 1-800 number. You can use that, but we usually probably would just route you straight to Grady, honestly. When should we contact them? Well, if we have a stable patient and time permitting, sure, call them up. And a lot of times what they'll do is they'll take your information, tell you what treatment to provide, and then they'll call the receiving hospital and let them know that you're coming in and what treatment the hospital needs to take. So it's pretty cool. But that's when you would use them, if time allows, you have a stable patient. It doesn't supersede you calling, it doesn't supersede your protocols, and it doesn't supersede you calling medical control. All right, so let's talk about absorption. So, I'm sorry, let's talk about the ways drugs can be absorbed. All right, so there's 4 ways: ingestion, inhalation, injection, and absorption. So those are the 4 we're going to talk about today. And we'll start with ingestion. And so the thing about ingestion is that it buys us some time. If somebody takes something by mouth, it buys us some time. And the reason why that is, and we learned this from the study in the GI, when GI emergencies, is that the stomach is a holding container for food. It meets up with acid in the stomach and starts being processed, but nothing usually gets absorbed there. So absorption occurs in the small intestine. So we learned that. So if we can do something to get the poison out, or something to neutralize it while it's in the stomach, then that's our best opportunity. So a couple of things. One, you might hear of syrup of Ipecac. I don't know if you will or not. If you do, it's on its way out the door. And the reason why that is because what it was used for was to induce vomiting. If you got there and they just taken it, you could give it, they would vomit, and emergency resolved. Problem was, or is that anytime somebody takes an overdose of medication, if they react to it in a way to where they become drowsy or unconscious, then we have an airway problem and we have somebody vomiting, and that's not good. So that's the biggest reason why that medication is out. Here we have activated charcoal, and like I said, I think I mentioned it before, never use it, but I used it the other day. So it's definitely there for a reason. And what it does is it absorbs the poison, right, and helps to remove it. And so a lot of that's what it is used for. But again, it has problems too. You got somebody, they'll drink this activated charcoal, but then again, if somebody becomes altered and then they're drinking this stuff and they aspirate, then we've got another problem, right? So it's not very popular in the pre-hospital setting. A lot of times, so let's talk about treatment. So treatment for poisons by ingestion, usually will consist of just providing oxygen, right, if needed. If it's a pediatric patient, providing oxygen as the patient will allow, and transport. We just don't, that's usually our best bet is to get them there so that activated charcoal can be administered a safe way. They can put an NG tube down, deliver it straight to the stomach. Inhalation. So inhalation is a different story. Again, most common home medications can be inhaled, household chemical products, your preferred spray paint color, but inhalation unfortunately can go straight to the bloodstream. So the physiology behind that is the same physiology we've talked about before in breathing. When you inhale, that goes down the trachea, into the bronchi, bronchioles, and into the alveoli. What happens in the alveoli? Gas exchange. We exchange CO2 for O2, right? Well, when we inhale something, a poison, it goes straight to the alveoli and goes straight to the blood, just like oxygen does. And it attaches to whatever, red blood cell, transport that back to the left atrium, left ventricle, out the aorta to the body. So it's pretty, it's immediate. And so that's the bad part about it. In order for inhalation to occur, you have to be in a toxic environment, right? Whether it be a carbon monoxide poisoning, which is a big inhalation poison, because carbon monoxide has an affinity for hemoglobin, and it will attach that red blood cell. I think the book says 200 times more readily, I think, than oxygen will. And your pulse ox will still tell you it's 98%. It can't differentiate between CO and oxygen. On these calls, a lot of times you'll need support. You may need a hazmat team. And typically there's more than one patient on those carbon monoxide poisons especially. Well, there's the alveoli mentioned on the slide there. Your first consideration on these calls is your safety. You do not need to be in an environment full of carbon monoxide. You also need to watch out for the other types of calls, like the suicide attempts by carbon monoxide, or what about it's not as popular as it was just a few years ago, but suicide by car. People would mix certain chemicals in their car, tape the windows, all that, with some duct tape, and were committing suicide because what they were creating was very toxic, and it was a quick suicide. And if you get exposed to something like that, it's a bad day. So your safety is always first. Now we move to poison by injection. So bad thing again here is we're straight to the bloodstream. We can't get it back. We can't dilute it. It is what it is. And so we're left with the symptoms of whatever poison that they've put into their system, or whatever drug accidental overdose, But you cannot dilute it. It's already there. And so I think we already understand the physiology behind that. And then we have absorption poisoning. And I think organic phosphate is probably your worst absorption type emergency. Usually the organic phosphate can be found like in your pesticides. We have other absorption type chemical solids like corrosives, like very alkaline type things that can cause chemical burns and that sort of thing. I gotta pause you guys. Hang on a second. Okay, I'm back. Sorry about that. So, so organic phosphates, what we were talking about, absorption, poisons. So let's continue to the next slide. So signs and symptoms of poison by absorption. And so these poisons will eventually make it into the circulation if we don't do something about it. So we got to get this stuff off of them. And so there's a couple things. One, you have to protect yourself because you don't want to get what's on the powder or whatever's on them onto you. All right, so hopefully hazmat's there, but it's important to get the clothes off. Okay, so it's very important to get their clothes off because you don't want to contaminate yourself, your ambulance, the hospital, the people in the hospital. So we have to expose them, get those clothes off. Signs and symptoms: burning, itching, right? Skin discoloration, burning, redness, those sort of things. And when we talk about organic phosphate, there's a whole symptoms there that we'll talk about in a second. When we talk about getting the contaminants off, be careful flushing stuff. Try to identify the product. Some products, adding water to them can cause, this can cause it to be worse. So got to be careful on that. But if you can't identify it, get as much of it off as you can, and then provide copious amounts of flushing or water for up to 20 minutes. And that includes when you're irrigating the eyes, usually 20 minutes. This is something, again, you're probably going to need some help. You're probably going to need like a hazmat decon team to get this stuff off. And if it's just one patient, it's just one patient. I mean, that's what hazmat's there for. Bring them on out. Then after you've cleared that, if you can't identify the product, great. Get the MSDS sheet. Take a picture of your cell phone of the labels or whatever to provide for the ER, especially after they've been decon. That was important. All right, the Toxidromes is something that it's in your book, and you need to know those. It lists stimulants such as cocaine, amphetamines, certain sinus medications, narcotics such as heroin, keeps going down, synthomimetic drugs like epi and albuterol, sedative type drugs, diazepam and Valium, chlorogenic, anti-chlorogenic. So those are all important to know. It's really important to know that the anti-chlorogenics are your parasympathetic blockers like atropine, certain antihistamines will cause patients to be tachycardic, among other symptoms that are listed in your book. So understand that these patients can be very tachycardic because the parasympathetic nervous system has been blocked. I think we already know about substance abuse from your EMT training. You understand withdrawal syndromes. Okay, none of that is new material to you guys. Okay, well, we already know this. I would know that dose of activated charcoal, especially for registry. 25 to 50 grams for adults, 12.5 to 25 grams for children. Know the side effects of activated charcoal. All right, so I'm going to mention this when we talk about alcohol and alcoholism. People with alcoholism, they tend to have chronic malnutrition and they fall a lot, so they're very susceptible to head injuries. Due to the malnutrition, these patients can be hypoglycemic. And when we talk about medical problems associated with alcoholism, we can talk about DTs. And not only can they be hypoglycemic, but going through DTs can bring on seizures. Seizures can be brought on because of their alcohol level. Their body's got used to it being high, and so a sudden drop in that alcohol level can bring on a seizure, or it could be from the hypoglycemia bringing on a seizure. So be prepared for that. Remember, when we're talking about narcotics, these are your list of narcotics: morphine, codeine, heroin, fentanyl, and it goes down. These are the only drugs that Narcan will work on. So if you got a test question and it's got more, all the following except, whatever Narcan is effective for, find the one that's not on this list, because that's going to be your answer, because Narcan does not work on narcotics. I'm sorry, Narcan does not work on anything other than narcotics. When we talk about cocaine as a stimulant, there is something you need to be aware of, if you didn't already know this, that cocaine, crack cocaine, any type of stimulant can bring on a cardiac dysrhythmia. What happens is it causes the coronary arteries to go into a spasm, and when that happens, blood can be cut off to the heart muscle, which is pretty much the definition of an MI. And so always be alert to that. Always be alert to that. One of my first calls here in DeKalb while I was being FTO'd was a 25-year-old who was having severe chest pain. It didn't tell us that he'd been smoking rock earlier. And so my FTO pretty much was like, hey, 25-year-olds don't have heart attacks, blah, blah, blah. But, we completed a complete assessment to include a 12-lead EKG. And when we did the 12-lead, it came back ST elevated MI. We repeated it, and it said ST elevated MI the second time. And sure enough, we transported him to Grady, and he was a STEMI alert. So, don't be fooled, on that, because it can happen, and it does happen. I'm just looking over my notes. So let's talk about benzodiazepines. These are sedatives. Okay, so these are patients who are going to receive this medication therapeutically to calm them down when they're violent. But when they overdose on these types of medications, then you can expect, a decreased level of consciousness, a coma, altered mental status, etc. So a benzodiazepine will not make somebody combative. All right, so when we're talking about tricyclic antidepressant drugs, they're antidepressants, so we already have somebody who's depressed taking the medication. That makes them a high risk for intentional overdose, okay? And they're a nasty overdose because what happens, these folks can have, from taking too much, altered mental status, slurred speech, tachycardia, hypotension, and dilated pupils. Okay, when you see that in a patient and you're trying to kind of put things together, think about overdose on a tricyclic antidepressant. All right, guys, and that basically, when you're reviewing this chapter, review your objectives. Understand, the 4 ways that you can, be exposed to a poison. Understand the pathophysiology behind that. I think I've hit the high points here. Again, I'm not going to repeat information that you've already showed competency on and you already know. But just review the chapter as you would per the objectives. Okay, and I will see you guys on the next recording for the next chapter. Have a good day.